Hello again. This lecture is about supervision and consultation. Okay, so forms of supervision. There are two forms of supervision that you may encounter as a therapist. First is individual or triadic supervision. This involves you and potentially one other therapist meeting with one supervisor, typically for 1 hour. This 1 hour of individual or triadic supervision counts as 1 unit of supervision on your hours tracking form. You will get to this later when you're training for becoming a trainee, but you need a certain number of units of supervision for each hour of client contact. So 1 hour of individual or triadic equals 1 unit. The second form of supervision is group supervision, which typically involves one supervisor and up to 8 therapists, and it normally lasts 2 hours. These 2 hours of group supervision count as 1 unit of supervision on your tracking form. Note that sometimes the 2 hours of group supervision are split so that you would have perhaps 1 hour of group supervision on Monday and the other hour of group supervision on Wednesday. Collectively, that Monday and Wednesday hour of group supervision, which make 2, would still count as 1 unit of supervision. What are the goals? So your training as an MFT involves supervised clinical experience. By working under the supervision of a licensed clinician, the goals are for you to be sufficiently supported and guided as you learn how to do therapy. The specific goals of supervision include becoming oriented to procedures of therapy and law, receiving guidance in ethical decision-making, which we've learned a lot about in this class, to increase your competencies, i.e. your scope of competence, and to prepare you for independent practice. Okay. Note that the amount of support that you need will change as you become more experienced, but it is recommended that even once you're licensed, you still continue to receive supervision. Just as a supervisor is responsible for guiding and supporting your training, you also have responsibilities as a supervisee. You are ultimately responsible for making sure that your supervisor meets all requirements to supervise you. We're going to get to that a little more later. You are also responsible for maintaining current BBS paperwork at all times. This includes paperwork for different states if you're planning to seek licensure out of state. Okay, so it's ultimately your job, for example, to keep your hour tracking form up to date and to make sure you have the supervisor responsibility statements for each of your supervisors. It's also your responsibility to remain abreast of laws and ethics. So the things that you've learned in this class may change, so it's your job to stay on top of them. It's also your responsibility to ask for help when you need it. Just like your instructors, supervisors don't know that you need help or that you're struggling if you don't disclose it. So that's what supervision is for. You've got to bring up the issues that you're working through or that you have questions about. Finally, remember that although your supervisor has the ultimate responsibility for client care, since you're working under their license, you have the immediate responsibility for the quality of care you're providing and are just as liable. It is not an excuse to say, well, my supervisor told me I didn't have to report something. You are the one at the front line having that contact with the client, and you are just as responsible, if not more. Okay, now supervisors obviously have responsibilities. So first, legally, a supervisor has legal responsibilities for that include notifying you if they have any changes to their licensure status or disciplinary actions by the board. Okay, so your supervisor should tell you, for example, if their license is revoked or suspended, because you can't work under them if they don't have a valid license. Okay, they must also maintain competency in the field that they're supervising you in by completing trainings or continuing education units, for example. They must monitor your work and your competence. That can be done by recording your sessions, by audio recording your sessions, by having consultation, and so on. And if they intend to stop signing off on your clinical hours, meaning like to stop supervising you essentially, they must provide at least 1 week of advance notice so that you can find a new supervisor. Okay, ethically, the responsibilities of a supervisor mirror that between a therapist and a client for the most part. So first, your supervisor should avoid dual relationships with you. For example, being your supervisor and your therapist, or your supervisor and your boyfriend. Not good. However, unlike the therapist-client relationship, you can engage in other relationships with your supervisor after supervision has ended. Okay, so if you complete your one year of your traineeship, the person is no longer your supervisor, and you want to pursue a romantic relationship with them, that is okay. Kind of strange, but okay. Your supervisor should also ethically help you with personal issues that may be impacting your performance as a therapist. So for example, countertransference issues. They should also avoid harassment and exploitation of you. For example, having you do their notes since they know you'll be afraid to say no. That would be exploitation and is unethical. And finally, they're also ethically responsible for making sure you aren't working outside of your scope of competence. And they can do this by either helping you refer clients out if they're outside of your scope, or helping you expand your scope of competence. All right, supervisor-supervisee confidentiality is a unique issue within the supervisory relationship. There's no confidentiality exception in California law that permits a supervisor to breach confidentiality to report a problematic supervisee to the board. This means if a supervisee discloses unprofessional conduct to their supervisor, trying to think what, like inappropriate behavior or like breaching confidentiality inappropriately, something like that. The law technically says that the supervisor can't report them to the board because it's confidential information. However, some supervisors or employers or agencies have a release of information related to unprofessional conduct added to the contract that you would sign to be a trainee there or to work there, so that your supervisor can actually report unprofessional conduct to the board legally. So this is something to keep an eye out for in your contracts and to be mindful of. Not that any of you are going to engage in unprofessional conduct, of course. Okay, now how to become a supervisor. This is the last thing that I'll share with you regarding supervision. And you may never intend to become a supervisor, but it's still important to know, okay? So why should you know this? First off, you may see a question about this on an exam, and that's a big deal. And second, you wanna make sure that your supervisor during practicum and during your associateship meets all of these criteria. Otherwise, the hours that they sign off for you may not count, and that would suck, okay? So first off, they must be licensed as MFTs for a minimum of 2 years, and they must have seen clients or provided supervision for 2 of the last 5 years. This is how the board makes sure that the supervisor is not out of practice, essentially. Next, they must complete a 6-hour supervision training initially to become a supervisor, and complete that same training again at every renewal cycle. That's it for supervision. Next, consultation and collaboration. Just got 2 slides here. First, consultation. So consultation should be sought whenever facing an ethical issue or dilemma, when treatment is not progressing as it should, when you become aware that something is outside of your scope of competence, when you are deciding whether or not you have reasonable suspicion to report for a mandated report, and when you're having countertransference issues, okay? So you should seek out consultation when you're having countertransference. If a vignette, for example, on an exam talks about the therapist's personal issues or mental health issues or substance use issues, in this case, you want to seek therapy, okay? So I'm going to repeat that again. When you become aware of countertransference, you want to seek consultation. When you have personal issues, mental health issues, substance use issues that are coming up for you, you want to seek therapy. Okay, so for example, a therapist who's like a recovering alcoholic and the client's issues are triggering that and making the therapist want to drink again, you should get therapy. Okay? Note that you don't need a release of information to do consultation, so long as you don't share any identifying information. So that keeps it confidential. Collaboration is different from consultation. Collaboration involves working with another provider to provide services for your client. So for example, if the client is referred to you by another source, like a psychiatrist, a doctor, a school, whatever, you can collaborate with them as part of a treatment team and provide services for the client. However, since identifying information is shared in this case, you would need a release of information in order to do collaboration. So this is why, for example, when working with kids, we get a release of information for their school so that we can collaborate with the school. Okay, so that's different from consultation, which has more to do with discussing issues in a case and doesn't necessarily require any identifiable information in order to do that consulting. All right, that's it for this one. Let me know if you've got questions.